Everywhere you look, people are talking about CBD. That's why it's such an exciting time to experience HempWorks, the best-selling, most in-demand line of premium CBD oil and CBD products for your health and wellness. Founded by entrepreneur, executive, and business coach Janice Wagle, HempWorks premium quality standards can be found from the top down and across the organization. From hemp farms to clean extraction methods to safe bottling, every step in our production process is vetted, monitored, and traceable, literally from the ground up. Thanks to our unique tracking system on the side of every HempWorks CBD tincture, we can track each batch of CBD oil all the way back to the farm it came from, all to ensure that you and your business are offering safe, effective, and high-grade CBD products. Including CBD tinctures, topicals, and soft gels, botanical face masks, hemp-based hair and body care products, CBD bath bombs, CBD fruit gummies, CBD coffee, even CBD products that are good for your pets. Recognized by the U.S. Hemp Authority Seal of Approval, HempWorks isn't just the CBD leader in product quality, variety, and innovation. We're actually helping to build a safer hemp industry from seed to shelf. Learn more and become an affiliate today.
Good morning, Vern. How are you?
Good morning. I'm just vertical one more day.
Good to see you again. Good morning, people in Mesquite. Anybody watching this show? Again, we have Dr. Vern on. He's going to continue some of his health talk, and hopefully today, Vern, supplements and maybe what they don't tell you about calcium absorption. We discussed that a little bit before.
Yes, I'll go into that. I need to correct something that I said in our last interview. I was saying that vitamin D, as we take it, must go through 2 physiological changes before the body absorbs it. One of them is in the liver and the other is in the kidneys. But I said that it was the artificial sweeteners that disturbed that physiological process, so it stopped the vitamin D absorption. But it was not the sweeteners. It is high fructose corn syrup that does that.
Oh.
And we've discussed the high fructose corn syrup thing. That's a plague as far as I'm concerned. That's worse than the virus. It just takes longer to kill you than the virus. The virus gets the job done real quick, but high fructose corn syrup takes years, and we're the highest country in the world for consumption of high fructose corn syrup. But anyway, that's the thing that disturbs the vitamin D intake. It's not the sweeteners. The sweeteners kill your good gut bacteria, which is part of your brain axis complex that we'll discuss later on. So getting back to the calcium. Calcium is very important in our body function because every cell has to contain calcium. Now, we stress that calcium is for strong bones and teeth, when really the most important function is calcium is what regulates your heartbeat. Calcium is the positive impulse, electronic impulse that causes your heart to contract. And potassium then is the negative portion of the electrical current that lets your heart relax. And that has to happen every single time your heart beats. The electrical impulse in your heart must reverse from positive to negative every time your heart beats. And calcium is the important factor there. And so the calcium will be taken from bones and teeth to keep your heart working because it's so important. So calcium is necessary. But I also feel that calcium is probably the most misused and misunderstood mineral in our body. And that being that because calcium is so important, it's important that you get the calcium, but there's a formula, I refer to it as a formula, that the calcium absorption process must go through. The first item that you must have is that it has to be an absorbable calcium. And there are all kinds of calcium out there. There's coral calcium, there's oyster shell calcium, there's calcium carbonate. That's the most common one, is calcium carbonate. And that is the least absorbable calcium that I'm aware of. It's cheap because they dig it out of the ground. And so it's plentiful. And so that's why so many companies use it. But it is very hard if any of it is absorbed. But when you have, let's establish now that we have an absorbable calcium. You take it into your stomach, and that calcium must be dissolved by hydrochloric acid that's produced in your stomach. It has to be dissolved in the stomach and within the first 5 to 7 feet of the small intestinal tract. If it is not dissolved and absorbed in that period of time, it will not be absorbed any place along the rest of the intestinal tract, and it goes in the toilet, literally. So that's the first item that must happen. When it's dissolved, then it must be through the intestinal wall and get into the bloodstream. That's where your vitamin D3 comes from. And we'll throw in the K2 or K3 that always goes with it. Now, don't get concerned about the K2 or K3, because I've been asked this, so which one do you need, the K2 or you need the K3? It doesn't matter. They're both really about the same thing, except one of them comes from plant source and the other one comes from animal source. Now, I prefer the plant source one because that's where we get most of our nutrients anyway. So now we're back on track. We've got it dissolved. We've got it absorbed into the body through vitamin D. Now there's other things that go along with this. I'm kind of making it simple because it's a complex thing. It isn't just, well, this happens, this happens, this happens. There's other things. Zinc is in there, phosphorus, all these other things play a part in the calcium absorption, but mainly it's your vitamin D to get it into the bloodstream. Okay, if it stays in your bloodstream, then it thickens the blood and then you are susceptible to a risk of stroke and heart attack. Now, there was an article issued by the FDA or somebody last August or September that advised particularly women that are taking calcium supplements not to take the calcium supplements because it put them at a 40% higher risk of stroke and heart attack. But you don't stop taking the calcium, you stop the retention of calcium in the bloodstream. That's what the issue is here, because they don't give you the rest of the formula to get it out of the bloodstream and get it out into the body fluids and tissues so the body can absorb it and use it. That's where your omega-3 fatty acids come in. And that's why they are so important. You have to have the omega-3 fatty acids. That's your fish oils. They come from a lot of sources, a lot of different kinds of fish. Your wheat germ oil is some of it. Avocados are good for this. And the so-called eggs that they told you years ago that would kill you and increase your cholesterol, I won't even go there. We've already talked about that dietary pyramid that was upside down.
Right.
They told you all these years, don't eat butter, that's fattening, it'll kill you. Well, it's the margarine that's killing people. I mentioned this before. I think margarine's killed more people than Cecil B. DeMille.
Right.
But we won't go there. This is what the situation is. It's calcium utilization. And if you're not getting enough calcium and other things, magnesium, phosphorus, zinc, then your osteoporosis comes into play. And until there's a serious effort to make sure about the calcium utilization, you're not going to cure these other conditions, such as the osteoporosis and other things that are very serious right now. That I've got a little thing that is ironic. People are eating antacids these days like they were Ronald Reagan's jelly beans.
Mm-hmm.
That they're throwing them down. So the first thing that you have with Tums is an antacid. And the sales pitch is take the Tums because it's also high in calcium. Well, okay, that's fine too, except it's calcium carbonate.
Not absorbable.
As I just got through mentioning, it takes hydrochloric acid to dissolve the calcium so you can use it. So here's a California duh. Does it make any sense? You're taking an antacid that kills the dissolving of the calcium, and it's calcium carbonate, which is hard to digest anyway. So how much value are you getting out of taking the Tums? And the antacid also, if you keep throwing those down all the time and you're not maintaining a good acid balance, then you're going to become anemic, because it's very critical in that process. Your digestive enzymes is where the red blood cell process starts. So it's very critical. And as I mentioned, it's probably one of the overused and misunderstood and misused minerals that we have in our diet right today.
Most doctors are really quick to diagnose nowadays acid reflux. And there are a lot of naturalists that I have read that say that when you do have that acid reflux or that indigestion, instead of taking an antacid, you should do just the opposite and take like apple cider vinegar or something that increases the acid, because it's the lack of stomach acid that causes the reflux.
Well, this is my opinion also. Opinions are like a
Yeah, you're right.
belly button. Everybody has one.
Right. Well, that's putting it nicely.
Anyway, research after research has shown that the older people get, the less acid they produce, the hydrochloric acid. And it's an indigestion factor, I think, that is causing this, because people don't realize that you can get a burn or an inflammation from an alkaline solution as well as acid. Now, if you don't think so, then put a drop of sodium hydroxide on your skin and see what it does. Sodium hydroxide is the thing that's in the old lye soap.
Oh, yeah.
Man, that old lye soap would take the chrome off a diamond plate bumper. And that it's alkaline. It's not an acid. So I've done this. One of the first things that I encountered when I first came into practice 61 years ago, and that was that people that thought they had an acid stomach, and there are tests that you can do. I haven't done them for years. I assume that they're still available, but you can take these crystals and mix them with water and drink it, and then you wait several hours and check the urine, and these crystals are only dissolved in the stomach in the presence of hydrochloric acid. And so within a couple of hours after drinking this crystalline form in this solution, then you took the urine sample, and if these crystals had dissolved, your urine would come out a nice pearly blue color. And I didn't do hundreds of the tests because I didn't have any reason to, but people were really having problems with what they thought was these acid stomachs. And in all of the dozens that I did, there was only one that I ever came across that actually showed the blue color. So they were not excessive acid stomachs, they were deficient. And so just for sneakiness, I'd say, well, you want to try something? I'll try anything. So I would give them a couple of tablets of hydrochloric acid. And in a matter of minutes, I mean, less than a half an hour, oh, that's wonderful stuff. My pain's all gone. What did you give me? And I said, hydrochloric acid. Duh.
I didn't even, they make that in pill form? Really? Hydrochloric acid?
Yes. Well, yeah. It's in most all of your digestive enzymes.
Okay.
Your supplements that you take that are labeled as digestive enzymes, there aren't any that I know of. I've never run across them. That if it's a digestive enzyme tablet, that the primary constituent of it isn't hydrochloric acid.
I wonder, well, because it's a caustic agent, I would think swallowing hydrochloric acid would affect the esophagus in some way. They have to process that to protect it from doing that.
It goes down. It goes down far enough and with enough water when you take it that you don't get that. But any of my former patients or people that ask me about things now and ask about the hydrochloric acid, I have them chew the tablet before they swallow it, because my opinion, like you were saying, my suspicion is I don't want a tablet sitting in a spot on that very delicate stomach lining, because it could erode.
It's concentrated in that particular, yeah.
And so I'm glad you mentioned that, because I do refer or recommend to people that, particularly if it's a hard tablet, that they chew it. And you can do that. They're kind of nasty.
They're very nasty.
Hydrochloric acid makes it a nasty taste, but if you chew it up right within your front teeth and you pulverize it and then take one big gulp of water with it, then it takes it down and dilutes it. So I always recommend that the people I deal with, that I recommend they do that.
With aspirin too, because didn't you mention something a while back about every time you take an aspirin, you lose about a teaspoonful of blood?
Yes, it causes bleeding in the stomach. That's documented. That isn't me. I didn't do those tests.
But you mentioned it to me, I remember.
Yeah. And you can look it up, and it's there. Aspirin causes bleeding, and that's why I haven't even touched on this for years, and I'm almost afraid to mention it now. But in years past, there was research that was done that indicated that when pregnant women took aspirin at a certain period in their pregnancy, that it causes bleeding at the level of the placenta. And because at that point, that's where the baby's blood and the mother's blood came together, which triggered the reaction, the RH factor reaction with the different blood types, A positive, the positive or negative. And because the mother's blood and the baby's blood should never mix. It should not happen. But if they do, and one or the other is positive or negative, it's going to trigger the immune response, and it destroys the other person's blood cells.
Right.
There was the indication that they thought that was possibly what was happening, is that the aspirin was causing the bleeding at the placenta level. And I'm not going to get into that argument, but at the time, it seemed plausible to me because there had been enough research done on it. But I haven't heard anything about that for years. They have the drugs now that counteract that reaction. They pick it up soon enough that they can counteract the action before the damage occurs.
Yep, just a simple shot. Yeah. So, okay, getting back to like the calcium absorption, how much of the calcium is just for your bones? I mean, calcium, like you said, it affects your heartbeat. It is the basic, the big building block to our bone structure, but it affects it, and it enhances the use of other organs as well, right? I mean, pretty much calcium is utilized by our whole body and our brain.
Oh, absolutely. Because I said each cell, in order for its function, doesn't matter what kind of cell it is, it functions because there's calcium there, and without it, the cells just don't function properly. But the body moves the calcium around, and the body knows which part of it needs the calcium. Your bones, the bones that you had in your body 7 years ago, are not the same bones today. All those bone cells, within 7 to 10 years, every one of those bone cells has been replaced. It's building, breaking down, building all the time from the day you're born.
So eventually what leads to osteoporosis, because those bone cells regenerate every 7 or so years, if they're not as full of calcium or they're deficient in the calcium, then the bones don't develop as strong or as hard. They become more brittle. And is that why people get osteoporosis as they get older?
Yes, there some hormone deficiencies that are kicked in there. That's why I say it isn't just one single process, but there's a hormone deficiencies, thyroid deficiencies, even lack of nitrogen. How many times have you heard anybody talk about nitrogen?
Not too much.
And yet it's one of the most vital things to keep your body regulated. And here again, it's required for every physiological process in your body.
Well, I know it's one of the major ingredients in plant fertilizer.
Yes, and that's the reason. But I think I mentioned this in one of our interviews. This nitrogen is so important, but it's probably the most plentiful thing that we have in this universe that we live in. It's in the soil. It's 80% of the air you breathe is nitrogen, but you can't use a single speck of it because the plant has to absorb the nitrogen. Then you eat the plant, then you utilize the nitrogen. And that's why I say that this calcium thing, it's the same thing. It has to go through a plant procedure before it's able to be utilized. But the nitrogen is ignored anymore. But yet it's so plentiful around us, but you can't use it.
I've had this conversation with a lot of people. And if you do believe in the Bible and the book of Genesis, that God put us here in a garden. Think about it. He did not put Adam and Eve in the middle of a herd of animals. He put them in a garden. Everything that they were given to nourish themselves and, was plant-based, essentially. So our bodies naturally you would assume that our bodies work better on plant-based products, right?
Well, whatever your office that you're running for, I'm going to vote for you.
Well,
that's my platform also. So I'll vote for you. You run, I'll vote for you.
Well, I don't know. Politics, I can argue politics. I don't mind arguing it, but I don't want to be part of any of that stuff. Boy, those people they'll either be trying to corrupt me or kill me. So I don't want either part of that. There's not much middle ground there.
The saving grace to all of that is all of this activity they're in an adrenal rush. and the adrenal rush is eventually going to kill them.
Yep.
Cyanide, only it's going to take them longer to do it. And they won't even realize what's happening when they finally start going through all of the qualms of aging and everything else that all of us go through. I'm not going to go there either. Let's get back on this.
We all had that same philosophy. You know, when I was 20, I was invincible. When I was 30, I was a little less invincible, but still much, you know, still I could conquer the world. But we don't realize now, you know, I'm nearly 60 and I am dearly paying for the things that I did in my 20s and my 30s thinking that I was invincible.
Yeah.
You know, the body doesn't wear down overnight. We start breaking it down way back, you know, years ago.
Yeah, I told you once before, you have to remember that the longer you live, the older you get.
Yeah.
Isn't that profound? Yes. So keep that in mind when your mind gets all bungled up.
Yeah. You know, that saying, that's one of my favorites, along with Bill Evans. You know, he's got the grocery store down there that he's been building.
Yes.
Well, for the first couple of years he was building it, I would go down there and I would interview him for a story. And I would always ask the question, when's the grocery store going to open? He always had the same answer. It's one day closer to being there. Oh, I just love that answer. I love yours too. The older you, the longer you live, the older you get. That is so true.
Yeah.
So, all right. So
keep in mind this thing about the calcium. The calcium's important, that you are putting yourself at risk if you don't complete the entire formula. And that's what got me kind of on the soapbox, because here they are out there, they're promoting vitamin D after 50 years that I know of. Anybody that said, oh, you need vitamin D, or you need vitamin C, or you need vitamin E, or you're a quack, you don't know anything, this doesn't make any difference, you get all you need from the food, rave on, and then all of a sudden somebody comes up with a supposedly brand new discovery. And that's what's happened with vitamin D. For some reason, about 5 years ago, I went into my annual physical at VA, and they asked me about my vitamin D, and they took the blood test to check it. And they said, oh, yeah, you're well within the range of vitamin D. Well, that's the first time I'd ever heard anybody that even cared about vitamin D, other than they said your milk's full of it. Mm. So this brought to mind, and so now this is common, that you're tested almost every blood test, they test your vitamin D. And so they're promoting the vitamin D, which takes the vitamin D out of your stomach if you happen to have some, and it's thickening the blood. So yes, and they're putting people at risk because they haven't completed that formula. So if you don't pay any attention to anything else I say in this or any other interview that we have, at least remember that it's important that you take calcium properly if you're going to take it. But fortunately, there's so much of it that isn't absorbed anyway, so it's pretty hard to get a surplus of something that isn't there in the first place.
Yeah, that's true. But you know, years ago, when I was a kid, I'm sure when you were a kid, Vern, we didn't have vitamin D deficiencies like we do today. And a lot of that reason is because we played outside as kids.
That's a whole lot of it. And you do get a lot of vitamin D from the sun, but we've gone over this before, that anybody that lives above the 35th parallel, and that's in north, they don't get the amount of sunshine that they do below the 35th parallel. And if you try to get enough vitamin D north of that area, there's exceptions, everybody isn't in the box and you have to fit in it.
Right.
There's little variation in these because of people's activities and what they do. But to get enough vitamin D that you need, you expose yourself too much to the sun and you wind up with skin cancer. And that test after test has shown that.
Yeah.
There are things that you can do to avert that a little bit, but basically overall, it's just an accepted fact that you don't get enough vitamin D from the sun if you live north, and if you do, you're going to get skin cancer.
So what about people who slap on an overabundance of sunblock? Are they literally blocking themselves from absorbing any of the vitamin D from the sun?
Well,
there are some people who they live by it. They won't go outside without it.
Well, and that's the case. If you're going to be outside and you know it and you're aware of it, then certainly you need the sunblock, because the alternative is that you're going to get skin cancer, but you're not going to get it right away. It waits years. When I was growing up, I grew up on a farm, and as soon as the ice stopped flowing down the creeks and rivers, then we had our shirts off and trying to get this beautiful suntan that everybody had to have. And wearing a hat was being sissy. And so we got out in the sun. So it was when I was in my 70s that they had to take about a third of my ear off because of skin cancer. And they thought it was melanoma at the time. That was in 1982 that happened. And so I've had recurrent incidents of skin cancer since then. So I know that this happens, and I relate it to the years that we were growing up and we weren't aware of sunblock. I never heard anything about sunblock till I was 25 years old.
But then I kind of worry about, all the chemicals and stuff that they put in sunblock. That stuff gets absorbed into your skin as well. Yes, personally, I'm not a fan. I don't wear it. I don't use it.
They've realized that. So many things have changed here, even as late as the 1960s. Your skin was supposed to be impervious. It was a protection that nothing would go through it. And
except a knife or a bullet or a piece of glass.
Yeah, it just isn't that way. Now we realize that skin is the largest organ of the human body. And you tell people, what's the biggest organ? Well, the first thing they say is the liver. And they don't even consider that skin is an organ. And it functions just like anything else. And things go in and out of that skin. Sometimes people get rashes and things on their body, and they break out in hives. Well, they try to find out what it is outside the body that's causing it. Well, most of the time it's coming from the inside. The body's trying to get rid of it, and it comes out through the skin and causes inflammation. Find out what's happening inside as much as what's on the outside.
a lot of people don't realize that your fingers and your toes, the tips, contain the majority of the capillaries, the surface capillaries. That there's more capillaries per square inch in your fingers and toes than anywhere else in your body. And all of those little tiny capillaries absorb things through them, and it comes through your skin into those capillaries straight into your bloodstream, as well as mucous membranes and stuff like your mouth, your eyes, things like that. Yeah, it's not an impervious thing. That's why now they're making topical, medications, the topical patches, skin patches. They make sure you wear gloves when you touch certain things because it's so easily absorbed through your fingers. Yeah.
Yes.
Skins.
Well, those capillaries, they don't realize it, but when your blood circulates, I've discussed this with some of our health classes, but your blood vessels, the arteries, keep getting smaller and smaller until a red blood cell, and it's microscopic, you can't see it with your bare eye, but it's down that those red blood cells have to go one at a time. They're lined up one at a time, going through that blood vessel, and the skin and your whole body surfaces. Your skin is so delicate. Myself, I use a safety razor to shave with, and once in a while you'll get a little place that is nicked. But if you look at your face through a big magnifying glass, the men, after you shave, it looks like a piece of raw hamburger. There's little tiny blood specks every place that razor has passed over. It just isn't enough to come to the surface so you can see it. But with the magnifying glass, and I'm serious, get you a big magnifying glass and get your wife or somebody to look at it sometime. It looks like a piece of raw hamburger.
Well, you consider, just bumping yourself and getting a bruise. That's blood underneath the surface of your skin. That's all that is. Blood that's seeped out through those vessels. You have
ruptured those capillaries for that to happen.
Yeah.
It doesn't take much.
No, but and every single one of those cells that squeezes out one at a time through those capillaries is ready to pick up anything and take it back with them.
Yeah.
Good and bad.
This body.
It's amazing.
So I think we pretty well got you convinced on the calcium, and you don't have to take my word for this. I haven't done all these studies. It's like I told you before, I've never been to the North Pole, but I think there's a North Pole because there's enough other people have been there, and I think I can say, well, yeah, I believe you. There's North Pole.
Well, Santa Claus says he lives there, so I mean.
Well, and Santa Claus doesn't lie.
No, he doesn't. He never lies. So, I gotta believe him. Although I personally don't ever want to go there because it's too cold. Right. That's what I hear. So I moved away from Ohio so I can get away from the cold. So, okay. Now that goes into the calcium absorption. You said the formula and everything, it has to be absorbed it has to be dissolved in the stomach and absorbed through the first 5 to 7 feet of the intestines. So during that probably goes well with most nutrients, which brings us to the brain gut axis and how really all of our health issues start in our gut. Is that true?
This is true. Now, there's some things that you don't want to be acted on or absorbed in the small intestine in that short space. The other nutrients and things just in normal digestion, they need to go all the way through the intestinal tract and into the large bowel where there is absorption, particularly of fluids in the large bowel. And that's where all of the good bacteria of the body that are essential for the brain-gut axis. But in getting to the brain-gut axis, then you have to include and understand the balance of the gut bacteria. And that's where this big push is on now for the probiotics. You know, there's the prebiotics and the probiotics, and they go on, and everybody's on the bandwagon now and expressing probiotics. Well, naturally, you've got to have the prebiotics. There has to be a start. So one of the problems that you have with these bacteria, and we'll just concentrate mostly on the probiotics now. If you're going to take a supplement of probiotics, and it isn't just one or two or three, there are literally dozens of different strains of probiotics. But most of your probiotics that are taken as a supplement are destroyed in the stomach and the first part of the digestive tract because the acid and the digestive enzymes kill those probiotics. So this is one where you want to take it in capsule form, and there's a patented type of calcium that doesn't dissolve for 3 or 4 hours. And so if you're going to take the probiotics, then take them in the capsule. If you're taking it in a packet that you dump in a glass of water, or you take it in a powder or a tablet, unless that tablet is designed to go a long ways through the intestinal tract, most of your probiotics are going to be destroyed before they ever get there. So you're wasting your money in doing it.
So look for the words enteric coated.
Yes.
Enteric coated will allow it to bypass the stomach acid and dissolve in the intestines.
Yes, later. And that's essential that happens. That yet there are very few companies that ever tell you that. I was doing some research just this past week on things, and I saw ad after ad. Well, this comes in, you can get this in 30 packets, and you read the instructions, open packet, mix with fruit juice or water or with the rest of your food. It's not doing you one bit of good.
Well, doesn't mixing a probiotic with fruit juice kind of, isn't acid kind of killing the probiotic?
It doesn't make sense.
Yeah.
We've talked about this before. Common sense and logic are two words that should be taken out of our dictionary. Nobody pays attention to that anymore. There is no common sense and logic.
People do what people tell them. They listen to a commercial thinking that's absolute gospel, but not realizing these people are going to tell them anything to push a product.
Yeah, the research, I can't even tell you how much garbage stuff that I go through to get an item of credible information, because you go through these research studies, and then at the very end, then you realize that somebody's trying to sell you a product.
Mm-hmm.
And if your research doesn't verify the product, you don't get any more research money, grant money. It's plain and simple. It's driven by greed.
Yep.
So look at your sources of where your information is coming from. And if you don't believe anything else about Donald Trump, it's fake news, but it comes from everywhere. It just is not in politics. It goes far beyond political. Fake news, and news, it's, to me, fake information.
Well, I think advertising was probably one of the forerunners of fake news in the first place.
Oh, you mentioned that. I don't know. I guess if you remember at your age dating yourself, but I don't know if you remember when there was a big issue about subliminal advertising.
Yeah. Drive-in theaters.
That was deadly. It was in the movie theaters.
Yep.
The studies about that when I was in college many years ago, and you wouldn't even know, but just one screen of what, the 60 that goes by every so many seconds, there's frames that go by. They put one, and they did the research by taking a specific product and just one flash, and you never realized that you had seen it, but it would be advertising Hershey bars with almonds. And at the intermission that they always used to have, people would get up like zombies and go out to the refreshment stand, and they would buy Hershey almond bars.
Yep, I remember that.
Just bar after bar.
They
promote a particular type of drink, a root beer. It had to be a Barg's root beer. And people would ask, and they didn't even realize what they were doing. Popcorn.
Yeah. And they say
put a law against it, but I don't know.
Well, they put a law against it, but I don't believe they've ever stopped it.
Well, it's all these ads when they go by, and you think, well, they're talking real fast because they're running out of time and they don't want to pay another $50,000 for the next 30 seconds. Now that's planned because your mind is picking up this stuff and it's registering whether you're aware of it or not.
And when they start talking real fast, people have a tendency to start listening real hard.
Yes.
Yeah. There's tricks.
Yeah.
They are tricky.
They work.
Sure do. Well, look at, have you ever in your lifetime seen within like the last maybe 5-10 years, so many advertisements for medications? You wouldn't even dream of a pharmaceutical company advertising a medication that is only available by prescription. Mm-hmm. And now you see it all over the place. Followed a few years later by the attorney commercial that says, if you've taken this drug.
Yeah. Oh, well.
But people are actually going to their doctors nowadays asking for specifics. And yeah, I mean, it's good to be aware of your health situation and things on the market and stuff like that. But when you start self-diagnosing and asking for medications that maybe even the doctor doesn't know about, or you know more about than he does or she, then there's trouble in what we're doing.
We wonder why there's addiction.
Yeah.
Because there's a pill or some shot or some kind of medications that's going to cure all of your ills, regardless of what it is. And that's the thing that I've been trying the last several years is I'm not selling anything. All I'm trying to do is share information and get people interested enough to do their own research and get enough information that they can come to their own conclusions.
Yeah.
Things.
Yeah. But, you know, most people, if it doesn't fit their opinion, they'll discount any opposing information. They won't even look into it, let alone take any of it to heart. You know what I mean? It's really difficult to get people to do that research. They really, most people don't. I don't know if it's that they don't have the inclination, the motivation, or whatever, but they're just happier listening to what somebody else says, you know, rather than finding out for themselves whether or not what they say is true.
Well, that always makes me remember Mark Twain's statement. His statement was, "It is much easier to confuse and mislead people than it is to convince them that they have been misled and convinced."
That is a very true statement.
When they sell somebody a bill of goods and they buy it, you can't convince them that they've been tricked.
No. And when, you know, it kills me now because before all of this 2020 stuff happened, you could not find a study out there that said anything about particular products and their effectiveness. And I'm talking mRNA had been studied for like 50 years. Never has the FDA approved an mRNA study. Never has an mRNA study been come out with a positive outcome. Most of the research had either been destroyed or the animals involved in that research died because of the research, and it never went any further. And now all of a sudden, you know, they approve it on an emergency basis into human trial situations, and people are running and running and running to go become part of that human trial without doing the research on what the animal studies had found, you know. But they're listening rather than researching.
Well, that's a very touchy subject, which I won't even attempt to get into, but because people have to make up their own mind and be comfortable for whatever decision they make. And what decision I make is only my business. I am not going to wear a sign like Hitler's had the Jews down in Germany before he exterminated them, that they had to wear a badge declaring themselves to be a Jew.
Right.
If they were caught not wearing that badge, they were shot on the spot. And I'm not going to go there. This is still a free country, and it's none of my business how you or someone else thinks, and it's none of your business how I think. And that's a right that I will defend to my death if necessary, because that is one of our basic human rights, that we have certain rights too, just like everyone else has. And it has to be a two-way street.
See, but what people don't realize is we're asking other people to respect those rights. And those people want their rights respected like we want our rights respected. And, yada, 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 but you're still asking man for man, God-given, something that's God-given. You should never have to ask
going to
him.
work. You
Huh?
might get away with it for a while, but it's not going to work. It has to be a two-way street.
Oh, absolutely. Absolutely. It's not up to any one individual to tell me what I can or cannot do. Even well, there are certain things that you just, to be nice to others, to treat people well, things like that, which kind of goes with a good society, if you do what you're supposed to do. But there's too many people who want to control other people. Tell them what to think, tell them what to do, how to feel, and we kind of grow up in that situation, being told what to do by clergy, by teachers, by, our parents, by our bosses, and sometimes almost forget that, there are some things that we really need to take the initiative to do on our own, not just wait to be told to do something. We get used to being told to do it.
It's like the old adage of the goat that leads the sheep to slaughter, and that is an actual occurrence. So whoever came up with that analogy had right on the head.
Yep. So what kind of natural things can we do rather than taking the supplements for probiotics? Because you never know. I mean, you never know what to take, what you can trust. But there are certain foods that we can eat that are almost guaranteed, right? To help with that?
Yes, there's some that the acid helps to enhance because of the digestive properties. Sauerkraut is one of the good probiotics. Certain types of yogurt work, but here again, it's not a panacea. Yogurt can help transport some of those if you eat enough of the yogurt. But then in the process, so many of the yogurts now are sweetened, and if they're sweetened, then you're right back in the same rut again. And particularly your artificial sweeteners, and that's the one that's critical that I misrepresented in our last interview, that I just had that twisted into my mind before I had a chance to think about it. But it's the artificial sweeteners that destroy the bacteria, the probiotics in the gut. The artificial sweeteners do that, and they do a better job than the antibiotics. And there is research down, and I've had to back off a little bit on my attitudes towards some of the antibiotics because of where and when the antibiotics are absorbed in the intestinal tract. A lot of the antibiotics that are given that we blamed for destruction of the bacteria haven't been that bad because they're absorbed before they ever get to the bowel. Now, some of them do get through, and they do have a definite effect on the antibiotics, on the probiotics, if you have enough of them. But it isn't as critical as we have had the attitude prior to just the last several years. But I've been doing research into that. And here again, I'm not against antibiotics when they're necessary. The whole healthcare profession has accepted the fact that antibiotics are being used too much. They're expecting too much from the antibiotics. And I personally have had my life saved about 1.5 years ago through antibiotics. And so when those are necessary, then you use them. That they should be used appropriately.
I've heard or read a lot about Candida, which can be caused by overuse of antibiotics, or certain antibiotics anyway. Do you know much about Candida?
Not a whole lot. I'm not an expert enough to even respond to that, Terry. There's some things that I have interest in because it, I've had a personal interest in it, but I don't try to get involved in so much of it because there's too much out there, and I'm too old, and this gray matter up here has got too many convolutes in there. They're full of dust and corrosion and scales. It's hard to keep everything organized, so I don't ask for more than I can put on my plate.
Okay.
The plate's getting smaller every day in life.
So, what is the best way to absorb? I mean, when you're talking probiotics, you definitely don't want any probiotics to go into your stomach. Probiotics are all for your intestinal tract. That's where they take effect. And what exactly do probiotics do for us?
The bacteria don't do much good in the small intestine. It's the large intestine where most of the activity of the bacteria go. And all of these receptors and the chemical reactions that take place have a definite bearing on how your brain functions. And this brain-gut axis is a subject that can go on and on for days and months and years, because they're just the last 4 or 5 years have become aware of the importance of the brain-gut axis. And that's where 80% of your immunity comes from. All of this vaccines and everything that there are so critical to our society presently, all of this protection comes from the brain-gut axis. And we just don't give it enough credit for the importance of it. But the bacteria, even the bad bacteria, have a direct connection to your brain cells, and those bad, the craving for sugar particularly. There are bacteria that crave sugar, and those bacteria can send an impulse to the brain to tell the brain, I need more sugar. Send me more sugar. And I know this sounds ridiculous.
Oh, no.
It's real. It happens. And it can affect your mood, your whole attitude. The way you think is affected by this brain-gut axis. And I know enough myself to understand it, that there's no way I could ever teach this, because I don't have the background in physiology to explain all of these complex things. I have a hard time remembering the cycle, what they call Krebs Cycle. And that's where each individual cell gets its energy from through glucose and ATP and all of this that takes place at each individual cell level to give you energy. And it's hard for me to remember that, what they call the safety pin cycle, but it's Krebs Cycle. So look that up sometime, just as interesting. You'll know what I'm talking about.
Well, I'll really confuse you, Vern, and sometime we'll talk about the circulatory system and how our respiratory circulatory system differs from the rest of our circulatory system.
Oh, yes.
That's a good one. If you really want to get confused or confuse people, that's a good one to talk about.
Yeah, it's so complex, and we go to bed, we eat a big beefsteak and chomp it down and go to bed and forget all about it, and the body takes over. It breaks it down, the proteins and that hydrocarbon chains that take place. It makes alcohol a sugar, or a sugar alcohol, and a fat into a protein into a carbohydrate, and a sugar. All this takes place in this laboratory while we're sleeping. Mm-hmm. Yet we're smart. We know all these answers, and we know what this body needs here. And it's ridiculous.
You know, our body has been doing for centuries and centuries what the scientists are just now in the last 100 years discovering it's capable of doing. And they haven't even touched the surface of it yet.
No, we don't have any idea how this, even our brain functions.
And it's been doing it all by itself for so long.
How are we doing for time here, Terry?
Well, we're just about at an hour and 6 minutes here now, I think. So.
Okay. Do we have time to go over another really important thing that's really critical?
Vern, I have absolute all the time in the world for you.
It's magnesium. I hate to keep bringing this up, but magnesium is just so critical to our health at this time. And most of us are deficient in magnesium, and particularly this last year and a half, where we've been under this pandemic thing, the stress and strain, that's one of the biggest usages of magnesium, is for the stress factor that we go through. But I mentioned this before, that magnesium is responsible. It is the catalyst for at least 60 physiological processes in the body, but it has over 300 enzyme interactions in this body, and some of it is in mood changes. Magnesium is a precursor to serotonin, which is one of your mood modulating hormones that keep your sanity, to say.
We all need a little more of that.
But we are so deficient in that. And the indication is now that the recommended dosage of magnesium should be increased by 3 or 4-fold of what they recommend. And the report I got just several weeks ago was that probably 80% of our population is deficient in magnesium. And
is there any side effect to having too much magnesium? I mean, like, you can have an overabundance of iron in your system and it causes issues. Is magnesium the same? So, I mean, if we just pile up, it's not going to hurt us? We take too much?
Yeah. Any research that I've seen on that, about the only thing that may happen, which is highly unlikely, is that magnesium may give you a little bit of loose bowel, maybe a little diarrhea, but other than that. And
so take an iron supplement and that'll balance it.
That would take care of it, yes. But I wrote down just a couple of things that magnesium deficiency, the symptoms of that, and I'll challenge any of the listeners to look up several sources and title it as magnesium deficiency symptoms. But I'll just give you a few just for fun. Abnormal heart rate, irregularity, muscle cramps, restless leg syndrome. How many people do you know that have had restless leg? I know several that people literally died from nothing more than the restless leg syndrome that they had fought for years. And magnesium in and of itself probably would have taken care of it. But that's one of them. Fatigue, migraine headaches, insulin resistance, high blood pressure, and even goes to the extent of nausea, vomiting, numbness. It goes on and on. There are probably 20 symptoms of magnesium deficiency, and I would dare bet that when you look down there, you'll have half of them. You'll suffer half yourself.
And so just for anybody listening out there, listen, the insulin resistance kind of leads to being overweight, right? To becoming overweight.
Oh, yes. All these things tie together. It isn't one just simple thing. It's a complex thing that one thing triggers something else, and one hormone is deficient in something else. We've talked about iodine deficiency in our soil, and the
goiters,
effect of iodine on your thyroid. And when it comes to your thyroid, in the fetus, the baby, the fetus, their thyroid doesn't kick in for several months into the pregnancy. And so that child is dependent on the thyroxine for the growth of its brain and the function of its brain. Well, their own thyroid doesn't take in for several months, so they are dependent on the mother's thyroid. So if that mother goes into the pregnancy with a deficient thyroid, then chances are that fetus is going to have a brain deficiency. See, and they don't realize how much one thing depends on something else, and that affects other parts of the body, and in the case of a pregnancy, another individual.
When we lack iodine, there's a lot of instances of goiters. What exactly, how does that form, the lack of it, and it affects the thyroid?
It's a disease of the thyroid, and it's a great big growth. It's like a tumor. And Utah, particularly years ago, had the highest incidence of goiter of any place in the world. And it's because of the deficiency of iron in the soil from the Ice Age.
Iodine in the soil.
Millions of years ago. And so to stop that, they added iodine to the salt. That's why there's iodized salt. But it's only enough to correct the growth of goiter. And it doesn't provide enough to make the thyroid function. So there needs to be a balance of that. And all you got to do is look around at your neighbors or even yourself and see the number of people that have a thyroid problem, one way or the other. And it's your diet has a great deal. And so, in kind of closing our discussion, there's the whole list of vitamins and minerals that are essential to this human body, and your vitamins particularly, and you can go down through the list: vitamin A, your vitamin B's, your whole complex, and I'll mention again referring to the vitamin B. There's how many? 7 or 8 different B vitamins, but in nature you do not find one of those vitamins in that B complex by itself. It's a complex. And you never even hear of this now, but brewer's yeast contains all of your vitamin B complex. But I haven't heard of brewer's yeast for years. It's probably still available.
I guess I'm aging myself because neither have I, but I have heard of brewer's yeast.
Yes.
Yeah.
And vitamin C is not just ascorbic acid. It's a complex. And your vitamin D, of course, we know that. And then I've already mentioned, we forgot about how important nitrogen is. That you've got phosphorus, you've got MSM, you've got glucosamine. And one of the things that here a few years ago that was a real issue was glutathione. There were people that were giving lectures on this glutathione supplement, that people had to have it. It's part of the essential amino acids. And it's the critical thing in aging. If people could get enough glutathione, they'd never get older. But when you take glutathione as a supplement, the body digests it and it's no longer glutathione. So you have to take other chemicals that the cell will produce its own glutathione.
Oh.
There was a very famous doctor that 40 years ago that gave lectures worldwide about this glutathione supplement. And he said he could get it through the cell wall. Well, any research that I've seen on it just doesn't happen.
He was selling some snake oil, wasn't he?
Well, I won't go that far because anyway, all we need to do is pay more attention and give this body credit for what it does, and do enough research to take an interest in your own health. There's nothing wrong with this age-old statement that you are what you eat. And that's basically what it boils down to. But we don't have the capabilities because of all of these artificial fertilizers. And years past, the farmers kept their manure and they put it out on the fields for fertilizer, returning the nitrogen to the soil. Now they take the nitrogen out of the ground and spread it around their fields because their fields are deficient, and it just isn't being utilized here again like it needs to be. So,
and when you do, I garden a lot. I will compost my things myself, add eggshells, coffee grounds and stuff to my soil, and just old debris, leaves and twigs and stuff. I have a tendency to compost all that, but when you go to buy that to really improve your soil outside of its natural state, it costs you a lot of money.
Yes,
Compost is very expensive to actually improve what God made so perfect in the first place, and we have basically ruined with our artificial fertilizers and chemicals and stuff.
Yeah, we've abused nature.
Yep. So now it's time. Yeah, I'm all about trying to rebuild, replenish. So I have a garden. I keep every year. It does improve, but so it was some serious clay soil for a while, which didn't offer much. I add worms to it and everything else, but I finally got some decent soil in the ground. I could actually market that soil for a ton of money. It's like liquid gold or like dirty gold right now.
Yeah.
So takes a while. Yeah, it's think about it. I mean, why should we spend so much time and money having to improve on what nature has already given us an abundance of? But so, on the supplement end of things, I mean, people should just be cautious about like the types of the brands and the types of supplements. Talk to somebody before they go out and spend a whole lot of money, because supplements do cost, a small fortune. Talk to somebody who's really knowledgeable about the products, the particular products they buy, and whether or not that particular product is an assimilable, it's assimilable into our body, right?
Yeah, and calcium is one thing I probably should have mentioned. Most of the calcium that people take is a hard, white, small tablet. Well, the first thing you want to do is find out what it is to start with, and they have to label the type of calcium. And there are many types. There's bone meal calcium and everything, but use common sense when it comes to oyster shell and coral calcium and all these. See where they come from. And to me, anything that's been in salt water for 100 years and that hasn't dissolved, I don't think it's going to dissolve in a couple of hours in your stomach.
Right.
Anyway, that's just a little snide remark there. But
what
anyway,
about like bone meal? You mentioned that calcium through bone meal. Isn't gelatin like bone meal based? Don't they make gelatin out of a lot of?
well, gelatin is just part of the bone meal. But
Okay.
with the bone meal calcium, that contains all of the ingredients that it takes to make bone, because it is bone. So there's the phosphorus, there's the nitrogen in there, there's the zinc and magnesium and all of the other things that's with it. But you have to be careful, because most of the bone meal calcium you get comes from cattle that they have fed the growth hormones to.
Mm.
And so you're getting an imbalance there. There's a few companies that harvest their own beef cattle and produce that bone meal. Standard processed labs out of Wisconsin, they have a good source of bone meal. There's probably others that I'm not aware of. But the calcium tablets I was talking about, drop those tablets in a cup of warm water and see if they start to dissolve immediately. But in any case, within 2 hours, they should be pretty much totally dissolved. If they're not dissolving in a cup of water within a couple of hours, then you just as well flush them down the toilet to start with, because that's where they're going to end up.
Okay.
So that's just a little trick, and see what happens. Any of your medications, if you want to see what's happening to them, just drop them in a warm cup of water and see if they start to dissolve immediately or if they dissolve after a while. And particularly anything that you're taking as far as the probiotics, if they start to dissolve within 2 hours, then you don't want to waste your money and buy any more of them.
Right. Yeah.
When they get to the gut where they belong.
Mm.
Just little simple things to do on your own.
I do want to mention to everybody, anybody else who happens to be watching this show and who watched the other day, our friend Tibisay, who joined us the other day in the comments, sending out prayers, good thoughts and vibes. Her husband suffered a heart attack on Friday. So Tibisay, I am sending you much love, lots of prayers for your hubby and you and your daughter. I'm sure that you're going through a lot right now. So that's everybody else. Say a prayer for her, please, and the family. And Vern, thank you again for joining us. We will move on to another subject next time. Tomorrow we have our Toastmasters meeting, so I know we won't be online tomorrow, but if anybody has any questions that you want to send in to Dr. Vern, put them in the comment section because we can always address those on a future show. And I will give Dr. Vern those questions ahead of time so that he can make sure he does a little bit of research to refresh his memory, because it gets a little bit less as we get older, but he can refresh his memory and his knowledge and be sure to answer those questions as accurately as possible. So there's possibility of that, right, Vern?
I would be happy to do that, and I am not a chemist or I'm not a scientist. I've never been accused of being those things. I've just been enough aware of things that of my interest, and I'm still having interest in all these things, but it's been 60 years since I really got into an organized study pattern where I was doing research and studying and being aware of all these things. And so unless you're using all of this information all the time, it gets away from you. It gets dust on it. And I mentioned before, it gets little corrosion and all those convolutions in the brain, and it's hard to bring them up. And people say, well, it's because you lost your memory. It's because there's so many things in the memory, it just takes you longer to dig through the information to get to it.
Right. Yeah, you have to it's like looking through the file, the card file, you just have to find that right card. Remember the old Dewey Decimal System in the libraries?
Yeah. You have to open the right drawer.
That too. So
not in alphabetical order.
Yeah. But there's so much. Well, that book, the Grey's Anatomy book. That book's that thick, and it's chock full of information, and that's probably only a part of what we know about what our body is capable of doing.
Yes.
And there's still a lot, so much of our brain function that we haven't clearly organized or defined. They say that we use very little of our brain function on a daily basis, and the majority of it is used for other things that some of it they know, some of it's motor function, memory function, things like that, but there's a large portion of our brain function that they're not quite sure what it's for or what it does. So that's all pretty interesting, but that could go on forever, that kind of discussion.
Yes.
So anyway, I want to thank you again, Vern. It's always great to talk to you, and maybe we'll get together. What, Wednesday? Are you available Wednesday?
I'll have to get back with you on that. We have some family coming Wednesday or Thursday, and I don't know what's going to transpire on that. So let me get back with you on that, Terry. But probably Wednesday morning would be okay, but I'll get back with you.
Okay. So, and
I would really like some feedback on things that people are interested in, because my interest may not be the same as your interest. And so if it's something that I feel that I've got enough background that I can comment about or give you information, I will. And if not, believe it or not, I just don't know everything. There's every day goes by that I can't find something that I didn't know before. It's getting a little harder, but at least I'll give it a try. So
you know what I would personally love to hear you talk about, and I know that you do have a model that you can work off of with this, is the correlation between our cervical, or I will say our vertebrae, whether it be cervical, thoracic, lumbar, coccyx, or sacral, how those peripheral nerves correspond to each parts of our body. Like when you affected your cervical vertebrae and you could have become a quadriplegic, or you did become a quadriplegic. At what certain point does our vertebrae start to affect our lower limbs only? And, so the correlation between certain vertebrae and nervous systems or parts of our body that those vertebrae and those nerves affect.
Yes, that's the whole premise of the chiropractic philosophy is the function of the body, the vertebral column, and its relationship. And there's no part of the body that does not have a direct correlation of function with the spinal column. And for years, for instance, they said, well, the cranial nerves never leave the brain, and so they have no connection with the spinal column. Well, duh, they do. The two, spinal accessory nerve and the vagus nerve,
right,
cranial nerves, and both of them leave the brain, and they have a direct contact with the rest of the body, including the spinal column.
Well, I heard here a fun fact I was taught years ago, that sometimes headaches are caused because you have to have a bowel movement, because your vagus nerve goes all the way down to your bowels. And if there's pressure on that, it could cause headaches.
And that's true. All conditions don't fit in the box that the healthcare profession have put them in.
Right.
And before I make any conclusion, any patient that I ever had in my life, I determined first whether or not I was convinced that it was a chiropractic problem. And if it wasn't, I referred them out to somewhere. And I don't care what a person's choice is. If they want to choose acupuncture, that helps a lot of things, but it is not a panacea. Yoga will cure a lot of things, but it is not a panacea. And certainly the practice of medicine is not a panacea. It just, there's no one single thing that can cure anything, but nobody cures anything for anybody else. The cure has to come from that individual. Because if all of these things worked on anything else, it would work on the cadaver. And I don't care if you've got an incision on the cadaver. I don't care how much ointment you put on it, how much iodine you put on it, how much mercurochrome you put on it. That is not going to heal.
Nope.
Just isn't going to happen. Everything has to come from this body. And I get real cynical sometimes. People can't find out they have a condition and they don't know what's wrong. And somebody says, oh, it's all in your head. Well, it is. I've never seen anybody that had their head cut off that has problems. That cures ingrown toenails. It cures everything. They don't have any problems anymore. So, yeah.
Vern. That's true.
Everything is in your head. Because if your head goes away,
all the problems.
If somebody has a bad attitude, if you hold them underwater for 10 minutes, their attitude changes. Goes away. I'm being sarcastic. And
I know. It was
anyway,
funny.
But sometimes we have to step back and take a look at ourselves on what we're doing. And really, what are our attitudes? It just doesn't happen. And our suicide rates and everything are going up. And for what reason? Why destroy something so beautiful as this human body?
Because, like Dr. Joyce said, people have a complete misconception that if you commit suicide, everything is going to be so much better and more peaceful on the other side for you. And again, common misconception.
Well, you don't know what's over there. We've all been told what we hope is there.
Right.
But if this life goes on, as I hope most of us believe, then we still have things to do when we leave here. And it's a lot better to do them here than to try and do them when we don't have the facilities that we have here to take care of them. So, but the thing that is bothering most of anything, a person has a right, I guess, to take their own life, but do they have the right to affect the people that they leave behind? Because the people, the families, those families never get over that.
No.
If you leave a wife and 2 or 3 children to fend for themselves, when you could be there because of a few moments of depression or something, and this is not reversible.
Exactly. Everything else is fixable except death.
Yeah, it's yes, suicide is usually fatal. Yeah,
is that Barb laughing?
Yeah, well,
I've always heard it was.
Step back and take a look at what's happening. Does it really cure anything? Does it solve the problem?
No.
And most of these problems, if you want to, anybody listening, if you decide you have enough problems that you want to commit suicide, come and talk to me sometime. Just sit down and I'll go item for item for item with you. And then we'll add up the points. And if you can convince me that you've got more reasons to kill yourself than I have or had, I'll help you commit suicide. How can you take that offer?
You know what?
Sit down with me and we'll go over it point and point first. This just isn't an open invitation, but you got to come up with the figures first. and then we'll talk about it.
It's like Joyce said, what have you got to lose? If you're thinking about killing yourself today, it'll be just as good an idea tomorrow. Come talk to me first.
Yeah. Well, anyway, now maybe we're getting on a different subject.
Oh, well, that's okay. We're not set to any one particular subject. We don't have a schedule to maintain. We can talk about whatever comes up. So, but we are an hour and 40 minutes into the show, and I think people might get bored of listening to us by now.
Yeah, well, okay. We'll tune out for now.
We will. And let me know about Wednesday. Maybe we'll see Dr. Vern on Wednesday. Maybe not. But even if we don't see him, we always think of him with a very good feeling in our hearts. Let me know.
Yeah,
And
say again, I'm not trying to sell anything. I don't have anything for you to buy. All I'm doing is trying to share information. Some of this information that I gave you today, I got from seminars that I paid upwards of $1,000 for sometimes. And I gave it to you free. And you say, well, that's all it's worth. Well, okay. If that's all it's worth, if it's nothing, why, you haven't been charged anything anyway. So
that's right. You got your money's worth.
Yeah.
Right. But I think the information is valuable, and it's good common sense. You know what you remind me of, Vern? You remind me of one of the old-fashioned country doctors that actually makes house calls and sits down and talks to people about their health rather than plugging stuff into a computer, having that computer kick out whatever your diagnosis of the problem is and prescribing a medication. You feed people good common sense, things for them to think about, to take care of themselves before they need to go in and see that doctor and get that diagnosis. Preventative medicine's always the best, right?
Yeah, I made many house calls, and there was never anybody that was ever turned away from my office because of lack of money. And some of those folks that maybe didn't want to accept charity, some of them I put on a monthly basis of $15 a month. And that's when office calls were $10 and $12. That in Utah, where I practice, there were a lot of migrant workers. When the migrant workers came in, they were never, ever charged a dime in my office. They got their care free.
And I'm sure they had a lot of back problems too.
They would, and they were families struggling, and they were here temporarily for a period of time, and they made money, and so they could go back to Mexico and different places and really live like kings compared to the environment that they came from in the first place. And even in their quarters where they lived, most of them were much better than what they had at home to start with.
Yeah.
So that no one was ever turned away from my office because of lack of funds.
Well, we definitely appreciate all the good advice that you're giving us now. At least I do. I can't speak for everybody. I can only speak for me.
And I hope it's worthwhile. But give me your interests in your comments of what you might be interested in. If you want to know how to make an atomic bomb, I'm not going to go there, because you can go on the internet yourself and find out how to do that.
He might help you research where to find an old roller skate key, though, right?
I might do that, yes.
All right.
Take care and be safe and be well, folks.
You too. And goodbye, peace and love to you all, and we'll see you on Wednesday. I will see you on Wednesday. Maybe not, Vern. Maybe.
Okay.
Take care.
Thank
Bye.
you.